most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you 3 Necksercises. We came up with the word there, right? Well, we stole it.
Yeah, it was from one of our viewers, though.
So that stop neck and shoulder pain in 2 minutes. You can do daily anywhere.
Right.
So this is nice because you don't need any equipment. You just need your hands.
That's right.
And you can get that pain knocked down.
Right. And because we found, and as therapists, and the whole concept is to keep your neck mobile, keep the range of motion.
Keep as much motion as possible.
And in these particular stretches are the stretches that we find in the clinic as therapists to be the ones that really do the most work, do the most good for neck and shoulder pain. So should we get right to it, Bob?
No, by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com, our website. Go to the giveaway section. We're always giving something away. We're giving away our little mini massager here. This is the Q2,
yes,
which I call the QE. And actually, this thing is very powerful for being small. Very powerful.
It is.
It's shockingly powerful.
Yeah.
And you can actually get good leverage using it. And it also fits in your purse or your pocket or your...
Yeah. And it comes with 5 heads and a nice carrying case.
Yep, so it's a beauty.
There you go.
Go to Bob and Brad on Facebook. It'll be pinned to the top of the page, the contest. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program. Plus, we got podcasts now.
Podcast. You said it's a contest. I don't get it. It says like you have to write a essay.
No, you have to just you have to sign up.
Sign up, and then we pick it.
Yeah,
kind of like a drawing.
It's a drawing.
All right. Well, I just wanted to clarify that. Anyways, Necksercises. We already talked about the exercises that we feel from our experience and therapists abroad, and our viewers. Actually, we get a lot of comments from our viewers, and these
positive comments.
Exactly. So number 1, the first one. Now, 2 minutes. We're going to go through these a little bit with explanation. It's going to take more than 2 minutes, so don't comment. 10 minutes for a 2-minute video. So give us a break.
Yeah.
That's all fun.
Cut us some slack.
Yeah. Now, Bob likes me to keep this buttoned up, but I'm going to do this a little bit because you need to get your hands back, skin on skin for some of these. You'll see what I mean. The first one, and this one ad nauseum, we've gone over for the last 10 years. It's almost 10 years.
Yeah, it is.
Anyways, good posture. So if you're sitting at the computer, you're going to do it. Stop your work for just a little bit. Give yourself some good posture and do the infamous or the famous chin tucks. Posture. Chin goes in, not down, not up. Just do 2 or 3 of those. And then we're going to go to this point with the chin in. Take your hands, again, if you can get directly on your skin at the base of the neck. I can't see that because I'm going like this underneath. And then I'm going to put full extension. And you're going to support. Move your fingers to where it feels good.
Yeah, if you go back and it hurts, move your fingers up a little bit and see if that takes away the pain.
Yep.
You maybe won't bend as far, but it won't hurt then. And we usually do this with a towel, but you can use your fingers just as well.
And sometimes the advantage is using your fingers. You can get your fingertips into certain spots that allow those muscles to relax and you get better range of motion. Can you hear me, Liz? I'm moving my mic
and you
around.
can move the fingers with each extension. Now, I want to go back to the chin tuck real quick, Brad. With the chin tuck, the thing that's nice about it, one, don't go up, don't go down, just go back. But the thing that's nice about it, it's a reminder of where your head should be.
Right.
The final thing I'm going to say about Brad is you can do some overpressure with the chin tuck too. It actually feels really good sometimes if you have a headache in the back here, is actually do an overpressure and hold it for like 30 seconds to a minute.
Yeah, you sound good, Bob. Yeah, don't push really hard. It's relatively gentle. So that's the first stretch. We condense it down, posture, chin tuck with full extension. 3 to 5 reps of each should be adequate. You're going to find out what
you
want to
go further and further with that extension too, by the way.
Exactly.
Try to work on to the point where you get it way, way back. That'll help the pain.
Next thing, number 2 is simply rotation, both directions, right and left. You have to have good posture. The slight chin tuck is good, so you maintain that good rotation and posture, and you can just look to the right, and you may find one direction you'll go
My
farther
mic
than
is
the
pulling when I
other.
go to the left, so
Yeah. Now, both Bob and I have seen this. I'm sure anybody in the medical field who's seen a lot of people in their 60s, 70s, and 80s. This is one rotation that's very commonly lost as you
yes.
age. And I really think it's because they just don't do it
Yeah.
as much.
It's probably going to get worse now because you no longer have to look back when you're backing up your vehicle. They got the
Yeah.
cameras now.
Exactly. So again, the posture, rotate, you can hold, rotate the other direction, do 5 reps. You can add overpressure. In other words, my mic's falling off. Rotate to the right, and here, now if you, advanced way is take this hand, support the low neck on the opposite side you're rotating, and just go like
And
that.
you're pulling a little bit with that hand, right,
Yep.
Brad?
And you don't have to,
You just,
you can do it this way too.
yep, you can do it on either
Yep.
side, wherever it feels better.
Yep.
And just pull a little bit on the skin and pull it forward.
Yep.
And it just gives you that effect of trying to give support to the neck, but yet it helps move it too.
Exactly. It's a really nice little thing you can play with. So do
Yeah.
whichever one feels best, or if it, and sometimes you can have pain, and when you put the pressure and you add a little pressure, you can get the range of motion without the pain.
Yeah, this side or this side. You
Right.
tried which one is pain free.
Right. All of these should not create any pain.
Yeah,
If they
we're
do,
not looking for increased pain.
right, then you don't push through the pain. You don't want to irritate it. Next one, a gentle, we call it lateral or side bend. So that would mean up with good posture. Once again, I have my patients to say, bring your right ear towards your right shoulder without rotating. So it's like this.
What I prefer,
like
Brad,
this.
even as a cue, is to actually do a chin tuck first
Yep.
and then a side bend.
Okay. Yep.
Yeah. I do this one, so I have trouble
Oh.
going to the right,
Yep.
and I always have to do a chin tuck and then go to the right. Chin tuck and go to the right.
And do both directions. Now, I had a neck issue just a few weeks ago. I couldn't go one direction without sharp pain, so I would just work, actually very similar, this whole routine, but I'd only work the pain-free side, and that would free up the painful direction.
Yeah, I actually just go to the right because my left, I have pretty good motion. It's not a problem area for me, so
Yeah.
I just chin tuck and go to the right, and it feels really good to me. Really, this is the one that'll knock my pain down if I get neck pain.
I thought you were going to say knock your socks off.
It'll knock your socks off too.
But anyways, you can take your fingertips, and when you're doing this, if you want a little more stretch, just your fingertips here and pull gently. This is not one where, if you're one of those, a little stretch is good, a lot more is good, where you're going to grab your head and really crank on it, because it's not going to do any good.
Nah.
Breathe, relax, and a gentle stretch. They're small muscles.
Yes, they are.
And you don't want to tear one. and
Yeah, you
cause
don't want to
pain.
strain it. You don't want to
Yep.
tear it. You want
So
want to
these
give
are,
it take what it's going to give you.
right. Oh, wow. That's a good one.
Yeah.
Put that one on the chalkboard. Necksercises. Nice name. Really, these are out to do before you get neck pain, to
Sure.
avoid neck pain. But if you do have neck pain, approach them cautiously. Only do the pain-free directions.
Wonderful.
But what was a fast one, Bob? 8 minutes and 25 seconds.
All right.
You shouldn't get hollered at
we
for
can stop now.
babbling on this one.
Thanks for watching.